Hello everyone, today's topic is vitamin D. So what are the features of vitamin D? It is otherwise called anti-rachitic factor. It acts like steroid hormone. So it is not only a vitamin, it is a hormone. It is a pro-hormone. We will see how this vitamin D can be synthesized in our body. Because we know hormone is synthesized in one organ and it goes and acts in a different organ. So those molecules which act by this way, we call them as hormones. So vitamin D acts like that. It gets synthesized in the skin in our body and it goes and acts on organs like intestine, small intestine, kidney and bone. So vitamin D is both a vitamin and a hormone. Okay, yes. So how it acts? It acts like a steroid hormone. So what are the forms of vitamin D? We have two forms. One derived from the plant and the other one derived from the animal. The plant form is called vitamin D2, otherwise called ergocalciferol, and the animal form is called D3 and that is called cholecalciferol. Okay, so the plant form ergocalciferol is derived from ergosterol and the animal form cholecalciferol, it is derived or synthesized in our body from 7-dehydrocholesterol. So these are the two different forms of vitamin D. So what are the sources of vitamin D? One, it can be synthesized in our body. How? When we are exposed to light, vitamin D can be synthesized in our body. So it is photobiogenesis of D3 in skin. The other one is dietary sources. So we will see how vitamin D can be synthesized in our body. It is photosynthesis of vitamin D. So the precursor which is required for the synthesis of D3 is 7-dehydrocholesterol. Okay, the 7-dehydrocholesterol, when it is exposed to light, it gets converted through a series of thermochemical reaction and finally it forms cholecalciferol, that is vitamin D3. So this is how from 7-dehydrocholesterol, vitamin D3, okay, that is cholecalciferol can be synthesized. How it can be synthesized? By a series of reactions that are called thermochemical reactions. When the skin is exposed to light and when the 7-dehydrocholesterol is exposed to light, through a series of reaction it gets converted to cholecalciferol. And what are the dietary sources of vitamin D? Cod liver oil, liver, eggs, butter, cheese, milk and mushroom. So these are the dietary sources of vitamin D. So what is the recommended daily allowance of vitamin D? So for children, 10 microgram per day, approximately if you convert that to international units, it is 400 international units per day, and for adults it is 5 to 10 microgram per day. And where it is observed? It is observed in the small intestine, like all other fat soluble vitamins. It gets observed in the small intestine. Okay, it gets absorbed along with the fat with the help of bile salts, and it gets incorporated into the chylomicrons and it is transported to the liver where it gets stored. And whenever required, this vitamin D will be released from the liver, and it is a fat soluble vitamin, so it definitely needs a transport protein or a carrier protein. So here the carrier protein is alpha-2 globulin, vitamin D binding protein, otherwise called alpha-2 globulin. So vitamin D will be bound to alpha-2 globulin and it reaches the target tissues. And we will see how vitamin D is activated, because we saw it is both a vitamin and a hormone. Okay, so this cholecalciferol has to be activated. So how it is activated? First, what happens? We have two sources of vitamin D, right? One is plant source, the other one is animal source. Yes, the vitamin D which we take in the diet and the one which can be synthesized in the skin from 7-dehydrocholesterol in the skin. So when we are exposed to sunlight, the 7-dehydrocholesterol in the skin gets converted to cholecalciferol, that is D3. And we also saw the dietary sources which will give D2, that is ergocalciferol form. So this vitamin D has to be activated. So activation happens in two steps and in two different organs. The first activation happens in the liver. Here what happens is the enzyme 25-hydroxylase. So as the name indicates, hydroxyl group is going to get added. So 25-hydroxylase enzyme in the liver will attach the hydroxyl group to the 25th position. Okay, so which will result in the formation of 25-hydroxy vitamin D. This 25-hydroxy vitamin D will move to the kidney where you have an enzyme called 1-alpha hydroxylase, which will hydroxylate the first position, which will result in the formation of 1 1,25 dihydroxycholecalciferol, otherwise called calcitriol. So this is the active form of vitamin D. Only this can exert its action. Okay, so two-step activation. The first one happens in the liver with the help of 25-hydroxylase enzyme, which will result in the formation of 25-hydroxyvitamin D. Next, this comes to the kidney with the help of enzyme 1-alpha hydroxylase. It forms 1,25-dihydroxyvitamin D, that is called 1,25-dihydroxycholecalciferol, otherwise called calcitriol. It has 3 OH groups, so it is called calcitriol. This is the active form of vitamin D. This goes and exerts its action on the target tissues. So this is how vitamin D is activated in our body. And what is the inactive form of vitamin D? So instead of first position, if it gets hydroxylated at the 24th position, then it becomes inactive. This form will not exert the action of vitamin D. So this is the inactive form of vitamin D. How vitamin D will act on the target tissues. So the receptor of vitamin D it is similar to a steroid hormone receptor. It belongs to the superfamily of steroid hormone receptor. What happens? So vitamin D, fat-soluble vitamin, it can pass through the cell membrane when it comes into the cell. This vitamin D, it heterodimerizes with R receptor, that is retinoid X receptor. Okay, it forms heterodimer. Okay, 2 vitamin D, dimer means 2, right? Yes, so vitamin D, the calcitriol, the activated form of vitamin D, calcitriol, it dimerizes with retinoid X receptor. Okay, when this dimerization happens, the vitamin D responsive elements gets activated, which will ultimately result in the transcription of the genes which are under the control of vitamin D. Okay, so this acts in the nucleus because it has its receptor in the nucleus. Okay, like vitamin A, the receptor for vitamin D is also present inside the nucleus. Okay, and this goes and binds to RXR receptor and it dimerizes, and it will result in the transcription of the genes which are under the control of vitamin D. Yes, so by doing this action, what happens? Okay, so this mechanism of action we saw in the previous slide happens in bone, okay, in intestine and kidney. Okay, so by acting on these organs, what it does, how it maintains the calcium level. Okay, so we will see one by one. What happens when vitamin D goes and binds to the receptor in the nucleus of the cells in small intestine? It will result in increase in the absorption of calcium and phosphorus. So the action of vitamin D in small intestine is to increase the absorption of calcium and phosphorus from the intestinal lumen into the cell. How it does it? By increasing the formation of a protein called calbindin, that is calcium binding protein. Okay, this calbindin is a calcium binding protein. So when this protein is present, it absorbs more and more calcium from the diet into the cell. So vitamin D increases the transcription of this protein. Okay, what happens in bone? It increases the mineralization of the bone. That means it deposits calcium in the bone. Okay, it increases the mineralization of the bone by stimulating osteoblast, because blast means bone forming cells. Okay, clast means bone resorbing cells. Okay, so it stimulates osteoblast and increases the mineralization of the bones. And it also helps in the differentiation of osteoclast precursors, because whenever there is a low level of calcium, it helps in mobilizing calcium from the bone, thereby it maintains the blood calcium level. So it has two roles. It helps in mineralization of the bone, and it helps in the differentiation of the osteoclast precursor, and it mobilizes calcium from the bone whenever it is required. And what happens in kidney? Again, it helps in reabsorbing calcium from the kidney. It reduces the excretion of calcium. How it reduces the excretion of calcium? Because it stimulates the resorption of calcium from the renal tubules. So this is how vitamin D acts in bone, in small intestine and kidney. Okay, basically vitamin D tries to maintain the calcium level. It increases the absorption of calcium from small intestine. It increases the reabsorption of calcium from the renal tubules. It helps in mineralization of the bone, and whenever required, it helps in mobilizing calcium from the bone. So these are all functions of vitamin D with respect to maintaining calcium level. What are the other functions? So it helps in synthesizing and secretion of parathyroid and thyroid hormones. It modulates proliferation of cells. So these are the other functions of vitamin D. So what happens when there is deficiency of vitamin D, and what all causes the deficiency of vitamin D? So whenever the person takes inadequate diet, which is inadequate diet of vitamin D, okay, then when the person is not exposed to sunlight at all, or whenever there is malabsorption syndrome, because we know it gets absorbed along with the fat. So whenever there is any malabsorption syndrome, so in that case where fat will not get absorbed, so in those conditions there will be deficiency of vitamin D. So what are the deficiency manifestations? So it has a major role in absorption of calcium from the small intestine and the kidney, and it helps in mineralization of the bones. So whenever vitamin D is not there in the diet or not there in the circulation, it will result in insufficient mineralization of the bone, because we saw it is required for the mineralization of the bone. When it is not present, it results in insufficient mineralization of the bone. So because of that, it results in soft and pliable bone, and there will be reduced growth of the bone. Okay, so these manifestations, when it is present in children, it is called rickets, because we all have studied this in our higher secondary, right? So vitamin D deficiency in children will result in rickets, and vitamin D deficiency in adults will result in osteomalacia. Okay, so the main clinical features are related to bone, because vitamin D is required for mineralization of bone. So we will look into the clinical features of rickets. Okay, so what are the clinical features of rickets? So mainly it is related to bone, right? From head to toe, the bone mineralization is affected. So because of that, what happens? The bone becomes soft and pliable. So what are the signs? So if you look at the wrist, it will be enlarged. Okay, there will be beaded appearance of the ribs. Okay, that is called rachitic rosary. That's why we call it as anti-rachitic factor. Okay, the other name of vitamin D is anti-rachitic factor, because of its deficiency, it will result in beading of the ribs. That is called rachitic rosary. Okay, and it results in bossing of the frontal bones, and the chest looks like pigeon chest. If you see in this picture, it looks like a pigeon chest, and there will be forward bending of the spine, that is called kyphosis. And if you look at the knees, it will be bowed, otherwise called knock knees. Okay, if you see, it will be bowed. Okay, so bow legs or knock knees, and the abdomen will be protuberant. So the abdomen features will be pot belly. So these are the features of rickets. Okay, so how can we diagnose? So laboratory investigations, because it has a major role in maintaining the calcium level. If you measure the calcium and phosphorus, calcium may be normal or it can be slightly reduced. And the serum phosphorus, it will be reduced, because we saw it helps in absorbing phosphorus from the small intestine into the circulation. So phosphorus level will be reduced. Calcium, it can be normal or reduced. And in the bone, if you see alkaline phosphatase, the activity will be increased. And if you measure vitamin D directly in the circulation, it will be reduced. So these are the laboratory diagnostic findings in case of vitamin D deficiency. So rickets, we saw what are the clinical features of rickets and laboratory findings of ricket, and what are the different types of ricket. Nutritional ricket, that means nutritional, it is not taken in the diet. Okay, so when vitamin D is deficient in the diet, okay, that will result in nutritional rickets. And vitamin D dependent rickets, in that you have type 1 and type 2, because of a genetic mutation in 1 alpha hydroxylase enzyme, which is present in kidney, vitamin D is not converted to its active form. So that is type 1 vitamin D dependent rickets. And in type 2, what happens is the active form of vitamin D will be present in the circulation, but the receptor, we saw a receptor, right? A superfamily, it belongs to a superfamily of steroid hormone receptor, and there is a mutation in that receptor. So the receptor will not respond to the active form of vitamin D which is present in the circulation. So here in type 2, there is a defect in receptor. In type D resistant ricket, what happens? There is no problem with vitamin D, but because of the mutation, there will be decreased phosphate level. Okay, it is otherwise called hypophosphatemic rickets. Okay, yes, the renal rickets is because of any disease in the kidney, for example, chronic kidney disease, or because of the kidney disease, renal disease, the 1 alpha hydroxylase enzyme is lost or defective. So which will result in defective formation of active form of vitamin D. So those causes are called renal rickets. So these are the types of rickets. So moving on to osteomalacia, which is the same clinical features when it is present in adult. What will be the features in adult? Bone pain, yes, tenderness, that is bone pain will be present, and since the bone are soft and pliable, they are more prone for fracture. And if you see, there will be proximal muscle weakness. So these are all features of osteomalacia. So what happens if this vitamin is taken in excess? Because we saw toxicity is seen more commonly in fat-soluble vitamin because they are stored in our body. Yes, so when you take more than 1500 units per day of vitamin D, it results in toxicity. So more vitamin D, more calcium absorption, so it will result in hypercalcemia. So when there is more calcium, what happens? It gets deposited in the tissues. Okay, yes, so calcification of tissues, soft tissues, and this calcium also gets deposited in the blood vessels, heart walls, okay, kidney, and it will result in damage. So irreversible renal, heart and aortic valve damage because of this calcification. What will be the clinical features? So it results in weakness, polyuria, increased urination, weight loss and confusion. These are all the clinical features of vitamin D toxicity. So that's all about vitamin D. We saw what are the different forms and how it can be activated, what is the role of vitamin D with respect to maintaining calcium homeostasis, and what is the deficiency manifestation of vitamin D, and what are the toxicity manifestations of vitamin D. So that's all about vitamin D. Thank you.